My name is Richard Bartlett. I'm the director of the International Partnership for Innovative Healthcare Delivery. We are a fairly new organisation which is based at Duke University here in North Carolina. We're an organisation that came from the World Economic Forum, and through the World Economic Forum there was a two-year initiative which looked at successful examples of business model innovation, social entrepreneurialism, and disruptive ways of delivering global health around the world. The initiative also looked at what made some of these examples successful, some of the success factors in innovation in healthcare, and then has essentially founded what is almost like an association or a club for healthcare innovators where they can share best practice and expertise. They can get business and mentoring support from our different corporate sponsors around the world. They can access investment opportunities and essentially work on shared challenges and issues together, all with the vision of scaling what already works in the world and improving healthcare globally. So we officially launched at the World Economic Forum that has its annual meeting in Davos in Switzerland about 1 year ago from now. Operationally, we began in June or July of 2011. So we've been operating as an organisation for 6 or 7 months now, so fairly new.
Now, on the homepage of your website, there's a quote that actually describes why the organization itself was founded. And the quote reads, I'll read this for our listeners, how can successful innovations in healthcare delivery be replicated to increase worldwide access to quality healthcare while simultaneously making care more affordable? A year in, or less than a year in, do you all have a sense of an answer that's on the horizon?
I think we do. So the IPIHD got launched essentially because we saw a challenge exactly in this area. And the challenge that we saw was that there's many different healthcare organizations, enterprises that exist that have tried to pilot something. They've either found a new technology or a new way of delivering care, but they have not managed to get to a large scale. And we're really finding that this is for a various number of reasons. One of them is the ability to create an organization, is to operationalize an idea, and to essentially put, what we would see as a business around a piloted idea. So if you look at, different functions and things that any large organization would need to have, it's how to build those out. Access to finance and capital is another one of the challenges. And then the final challenge we're seeing is how you can work with governments, with regulators, with policymakers in order to implement a new idea. As it's one thing being able to pilot something which is small in a village or in a small community, but being able to make that part of a health system and make that part of either a government provision or a public-private partnership is one of the challenges that we're seeing. So we're really trying to work both with innovators, entrepreneurs individually, but also more broadly as groups to try and find ways to address some of these challenges. Yeah, absolutely. So I think there's a few examples. India is, I think, the greatest example that there is. And I did a trip last year to southern India where I visited various healthcare entrepreneurs, Aravind Eye Care, which many people would have heard about, Lifespring Hospitals, which is a chain of maternal care hospitals in Hyderabad, as well as some other innovative entrepreneurs that I know in that part of the world. And India is, both a country with, many perspectives and ways that has been able to be very entrepreneurial, very innovative across different industries. And it's very true in healthcare that this has been the case as well. And I think that's for many reasons. I think, firstly, the kind of regulatory climate in India is very different than it is in other parts of the world, and that they've, it's a lot easier to establish new models of care and to deliver care in different ways. I think that the government is slightly more open than other governments may be in order to collaborate and form partnerships with private sector players, and innovation entrepreneurs fall within that bucket. And then I think finally in India there is a need. It's a country of 1 billion inhabitants, and there's a real need to innovate and to do things differently within healthcare, because fundamentally 75% of people in India are paying for their healthcare out of pocket, and these people need to, are looking for lower cost options. They're looking for things that are, also better than the government provision. So India, I think, is a shining example of where we're seeing successful collaboration between the government and between the private sector. I think then there's a few examples in Africa, Rwanda, Kenya, Nigeria, 3 countries that spring to mind, where the government is thinking in a much more progressive manner, and the health system is, Tanzania is another example in Africa. The health system leaders, the Minister of Health, is slightly more progressive, slightly more adaptive to new ideas, and willing to explore what some of the opportunities are for engaging with the private sector and working with some of these healthcare innovators and entrepreneurs.
Sounds like a major common thread through all of the countries that you mentioned is the openness and interest of the government to engage with the private sector. And beyond that, the ability and flexibility of the ecosystem that the innovators are operating within to actually experiment and try new things and try new models.
Yeah, absolutely. So let me give you a couple of examples of people that we're working with on the ground. One example is Child and Family Wellness Centers, which started up in Kenya. It's a business franchise, nurse-run clinic across the country. They have, I think, about 80 or 90 locations. They're able to tackle, I think it's 70% of the the illnesses in local towns in Kenya, and 40% of the killer diseases. So they don't offer care for every single issue or every single ailment that patients may have within Kenya, but they really try to focus on the ones that are most common. It's a nurse-run model. It's a franchise, so it's takes the lessons of McDonald's and Starbucks and applies that to healthcare, and they're able to reach the bottom of the pyramid. Now, what that organisation has now tried to do over time is think about how do we take that model, apply it to other countries in Africa, and I think that we could write a list of 20 different countries in Africa where this type of model would be phenomenal benefit, and not just the healthcare of that particular country, but also from a development and kind of social perspective. Mm-hmm. They're looking at Rwanda as one option, and then my personal belief is that type of model could be used in many other countries in Africa. I think another natural one, which is more kind of an archetype of different models, is some of the technology-based models that we see around the world. So be that in the developed world, some of the kind of applications that you can now get on your smartphones, the devices that are starting to come out, to some of the teledoctor models that we see, working quite successfully in Mexico, India, and other countries that have, the kind of this high mobile penetration. Mm. So, Indonesia, Philippines are 2 other examples of that work quite well. So I think that's the biggest challenge, and as I see this model grow, and as I see the organisation trying to kind of move from one country to the other, I think local networks on the ground is one of the biggest things that you need to get right, because especially if you're a franchise model, you may well end up focusing on different ailments in one country to another, but the business principles that drive the model are the same from country to country. Just the approach would be different, the language of training would be different, etc. Mm-hmm. I think being able to collaborate with the government, getting the right qualifications or getting the right infrastructure in place that the government will allow you to kind of come in and do that is one of the most challenging things. And I think when you speak to innovators and entrepreneurs that are trying to take their model from one country to the other, it's being able to create an entire new network in that country is one of the challenging things to do, and that's both working with local businesses, it's working with government, and that a lot of innovators that are trying to take a model from one country to the other almost kind of feel that they're having to start the challenge right from the beginning. And I think part of this is, how you demonstrate to a government or to, the quality setters, regulators in a country, that the care that you're delivering is good quality, that you've got the right processes and systems in place to support what you're trying to do. And I think one of the challenges is how you demonstrate that. What are the metrics that you need to be able to show to a Minister of Health or to regulators that demonstrate that, you're not a cowboy operation. You are, an innovator that can deliver quality outcomes and improve patient care in a country. And I think that's really where the bigger challenge around replication of innovation occurs. Sure. So my role is the Associate Director. I essentially oversee and coordinate all of our operations. I work with a team of 4 or 5 individuals here. And that means many different things. I hold relationships with all of the different corporate sponsors and supporters that we work with. I drive the mentoring and business support that we give to innovators. I do outreach at events, conferences around the world, visit some of these innovators on the ground, provide support to the rest of the team that's here. I mean, it's and especially being a startup organization, I mean, no one day is the same, no week is the same, and it's a very evolving role. As we start to move into our second year, it's about how can we really grow very strong core divisions of what we do. How can we, establish ourselves as a serious organization around the world and get the kind of traction that we want. But fundamentally, how can we move from, being a startup that has done a whole load of things and got the kind of process of setting an organization up and running and see the type of impact that we want to see. So for me in 2012, it's about 2 things. It's about deepening the areas of growth that we're looking at, but also ensuring that we can show impact, working with the innovators and entrepreneurs that we are working with and showing that we can scale the business models that they've got. I am, yes. So I'm going over to Europe next week for the annual meeting in Davos. And I think, we're excited about this in, a few levels. I think being able to engage with senior leadership in different companies around the world about this topic. We have a private reception on innovation in healthcare is exciting. I think it's, exciting to see what new companies we can get involved. The forum has very strong networks into the biggest healthcare companies, IT companies around the world, but also a kind of growing, social space that they operate in, and they also do engage with entrepreneurs and innovators. So it's great from that perspective. And then finally, this is, it's our 1 year anniversary. It will be, our kind of birthday as such on next Thursday as we go into the meetings in Davos. So it's an exciting time of year. Yeah, I think it's been fantastic. It's for me, it's very interesting to see some of the new, examples of healthcare delivery around the world, some of the new ideas that people have got. It gives us an opportunity to find people to collaborate with, find innovators and entrepreneurs that we could work with in the future and form relationships with. And I think that what Ashoka and the Wood Johnson Foundation have got here is a fantastic opportunity and almost test bed of ideas that other organisations can tap into. So I'm very excited to be part of the process and continue to enjoy being involved in this.